Doctors of Reddit. If free healthcare for all happened tomorrow in the US, what pros and cons would you see in your profession from day to day? As a cancer doctor, there are many people who avoid going to the doctor due to fear of cost. Some people do not get treatment for cancer at all. Some people wait until it is late and their cancer has already spread. But most importantly in my mind, many people do not get the routine cancer screening or tests done when they first have symptoms. It is true that even those with insurance sometimes have other barriers to healthcare, including things like low health literacy, denial, alternative treatment preferences, misdiagnosis, etc. But affordable access to healthcare saves lives and costs less. As an example, my landlord in New York was in the Army Reserves, and just before his time was up he was called in to do 2 tours in Afghanistan. He is currently self-employed as a plumber and owns several rental properties. Several years ago he noticed a small lump on the side of his neck. He ignored it at first, but then when it started to grow he made an appointment with his PCP at the VA, who ordered an ultrasound, then a scan. It was eventually biopsied and shown to be cancer. He was treated with radiation alone, and 9 years later he remains completely cancer-free. Had he not had health insurance, as is the case for many self-employed people in America, he may not have had a PCP, or the cost may have caused him to delay care, or delay scans, etc. If he had waited, he very easily could have required extensive, invasive and disfiguring surgeries, months or years of chemotherapy, feeding tubes, complications, etc. Not only would this have cost much more to our healthcare system, he also might be dead despite all that. Having access to free healthcare quite literally saved his life, and was much cheaper overall. Too long didn't read Cancer Sucks. Cancer sucks much more if you are uninsured. This so much. I had a friend from work who died from cancer because she had to wait 3 months for her health insurance to kick in. If she had been diagnosed 1 day before the 3-month benchmark, the insurance would have denied her claim as a pre-existing condition. FM Doc here. The pros of mitigating what's best for the patient without having to worry about what's going to destroy their finances really outweigh any of the cons I can think of, to be honest. Outside of people with low health literacy or outright ignorance, the biggest barrier to getting routine screening and follow-up is cost. Same goes with medication. Seriously, insurance formulas can change up to 3 times a year, and when they do, your 5 Pro Air inhaler is instantly $170 unless I switch it to a 5 Ventolin inhaler. Sometimes it's just as simple as putting substitutions permissible on the script, but not always. I'd honestly and genuinely like to hear from anyone in primary care who can think of any substantial cons to universal healthcare that would outweigh the benefits. I have to say that I really appreciate all the reasonable discourse I've received. Even if we don't see eye to eye on the matter, it's really encouraging that Reddit doesn't always have to devolve into vitriolic cynicism. However, if you've read some of my responses, you'll see that I have a lot of patience and I live in a small area. Today was kinda a fluke for me, as I usually don't have this kind of time to dedicate to responding to people on Reddit. Even if I try to stay semi-active around here, I'll probably wind down on responses right now, but I'll try to chime in whenever possible if anyone feels like they have a heartfelt question and cares about the feedback of a humble, rural family doctor. Haha. Thanks everyone. Fun fact. It's technically illegal for pharmacists to change between Ventolin Pro Air Prevental or between generics of the same, because they are not AB rated equivalents due to some clerical nuances. We also can't change tablets to capsules or vice versa. The differences between these medications can literally be hundreds of dollars. We do anyway, cause damn the man. Tomorrow. Okay, let's have fun and be very literal about this. For context, I'm an emergency physician in a smaller community, so I'm accustomed to seeing a mix of people who are privately insured, people with Medicare, Medicaid, vets from the local VA population which is unusually large, and people who have no insurance. If healthcare for all popped into existence tomorrow, it would be a huge mess. The system would reel with the shock. Primary care, particularly, would both be blessed to no longer shoulder the burden of underinsured patients needing primary care and stressed Single payer systems very quickly understand that investing in preventive care saves dollars. So those systems build structure for providing health education, diet education, exercise education, getting everyone screening tests and awesome early diabetes care. That's a lot of catching up. Because here with our current system we disincentivize lots about management of chronic illness. It can be hard to get nutrition or diabetic test strips or blood pressure medication covered. From what I hear, in single payer systems, if a patient inaccurately triages themselves, the system gains permission to redirect them. I'm currently the safety net for how messed up access to care is. I legally cannot refuse to see that one guy who shows up for athlete's foot by ambulance, or a rash that's been the same for 4 weeks, but she's been unable to get into primary care, or the guy who ran out of diabetes meds, or the ankle that was sprained yesterday but still hurts. I understand my role. I understand why the safety net is important in the US. I would be very happy to instead be able to tell these people you belong at primary care and poof you have the ability to get in within a few days. Or you belong at the sports clinic and poof you can go there tomorrow. I do love my job, but I do spend a lot of time patching holes in access to care. My training is in resuscitation, intubation, reducing dislocated joints, sewing lacerations, diagnosing sepsis or new psychotic breaks or anaphylaxis. I currently spend about a quarter of my day hating the US system's barriers to effective primary and preventive care. Not my training. Not a good sign for the patients that they've been forced into that place. Not the smoothest way to navigate the system. Sadly it clutters up time I could be getting to the next emergency patient. I also spend a fair bit of every day talking to frightened or angry people about their healthcare costs and battling the effects of those costs. A young woman whose prescribed insulin was too expensive and she felt uncomfortable advocating for herself and instead went into a diabetic coma. Outcome was good but her ICU admission venous pH was 6.68. The lowest I've ever cared for that lived. I thought she was going to die. Her mother hadn't known she was going without. People want to know the cost of that CORT scan to diagnose kidney stones. There's no way for me to possibly know that. It varies thousands of dollars between plans. I ache around this. It's terrible not being able to engage in transparent discussion. Until we go single payer I will never be able to tell a patient how much a gram of acetaminophen costs for them. For many, it's zero and a great help in multimodal analgesia. For some, it's some stupid inflated cost. I don't know. I can't have an hour-long insurance company call with each patient. I need to see 2.5 per hour including time spent talking to specialists, doing procedures, etc. I would sincerely love to not do that stuff anymore. No more my meds used to be covered, and no more I couldn't afford the cost of treatment, but now I'm worse. I think it will be a painful, bumpy transition to single payer, and I may indeed take a pay cut though I think that's not as bad as some make it out to be. Aussie and Brit docs as compared to their peers do okay. I feel very strongly that our nation needs this. I feel it deeply, and the lesson is ingrained more deeply every time I go to work. People want to know the cost of that CORT scan to diagnose kidney stones. The way co-pays work for this is stupid too. As a follow-up to several bouts with cancer and several surgeries, I get scans every 6 months. I used to get a MRI abdomen and pelvis with and without contrast, and a chest. CORT. The MRI takes the better part of 2 hours in the machine. I have to change into a hospital gown. There's an fourth in my arm. The pump for the contrast itself, and 3-4 ad-techs. So it's costly. The CORT takes about 5 minutes, and I do it in street clothes. If I get all of the above scans done at the same time, in the same facility, my copay is $40. Since I've been clear for 3 years, my doc said I can bump the MRIs to yearly, but still needed the chest CORT at 6 months. The copay for just that was still $40. There are a lot of things that are good effective treatments, supported by evidence, that Medicare does not cover for archaic and obsolete reasons. The somewhat free market of insurance has made carriers have to compete somewhat to offer treatments THST patients want and need. With one carrier, those patients may find themselves out of pocket for services that were previously covered. You might not see this competitive benefit when you buy insurance because you may not have an option when your company offers one brand. However, the company has hopefully looked at and compared various benefits packages. Also, for even more archaic and obsolete reasons, vision and dental are separate, as if your eyes and teeth are separate from your overall health and quality of life. This is because teeth were previously considered non-essential bones. Yes, not needing 5 people in the office just to constantly phone insurance for verification would be great. If you see a healthcare office, one is scheduling appointments, 5 are waiting on hold at insurance carriers chasing verification of benefits or chasing down bill payment. Insurance often likes to run small offices around in circles for the maximum amount of time and refuse to pay the actual costs of care. This leads to the bill going directly to the patient who has already paid their insurance, or to the doc writing it off as a loss. Can't have an employee sit on the phone for hours when the hourly rate is $25 and the bill is $50. Insurance companies know this and abuse it. There are a lot of things that are good effective treatments, supported by evidence, that Medicare does not cover for archaic and obsolete reasons. Australian here in those cases my private health fund covers it. And anybody who can afford to have medical insurance at all in the US could easily afford our private system, which you get on top of the completely free public one. I'm an emergency room doctor. Pro people could seek medical care without worrying about ending up bankrupt. They could also access preventative healthcare to avoid bigger problems in the long term, although Americans are really bad about this. Even when their healthcare is paid for, a lot less money going into the healthcare system. I don't care as much about my paycheck getting smaller, but there are a lot of smaller community hospitals operating on razor-thin margins that would likely be forced to close. Paradoxically, this could result in many people losing access to care. Too long didn't read. I'm definitely in favor of ensuring universal access to affordable healthcare, but things are shockingly more complicated than declaring medicine is free now. Primary care mid-level provider here working in a rural office in the south. It would be a game changer. The biggest positives would be that my patients can finally afford to come see me consistently. They won't have to choose between the insulin I'm prescribing, the lab I'm ordering, or the specialist I'm referring them to, and things like paying rent or buying food. Better yet, they might actually come to see me to get some real preventive care, so I might be able to find the tumor in their colon before it decides to metastasize all over to a point where the only treatment they can get is comfort care, or they might not feel like they have to cram all their complaints into one visit because they can't afford another copay for a separate visit, even though a separate visit will get the best, highest quality evaluation of your complaint. All of that in turn makes my job easier to do and less stressful. I'm no longer having to take into account the cost of what I'm doing, not that I ever really know that anyway, and instead I can focus all my energy to figuring out what is wrong with you or the absolute best way to manage your diabetes, instead of rushing because I'm running behind after taking 10 to 15 minutes calling your insurance company to justify why you need a sleep study or a stress test. I went to school and dedicated years of my life to training to learn how to take care of people, not worry about the business of it. It certainly wouldn't be all sunshine and rainbows though, as others have mentioned. An initial transition would mean a large influx of patients into primary care clinics, especially in rural settings like mine, where some of the more significant barriers to care currently exist. The primary care system is already strained as it is, so this could certainly lead to increased burnout, although I've also seen burnout defined by some as really an end product of moral injury, and if you are improving working conditions you may see less burnout. There would likely be an increased focus on reimbursement to the primary care level though, so I wouldn't foresee significant decreases in salary to those in my position. Other specialties may suffer to some extent though. However, you certainly couldn't have Medicare for all, at least in the format Medicare exists in its current format, and expect it to be anything other than a disaster. The reimbursement is just too low. However, if you don't have the obscenely inflated charged rates by private insurances to hospital systems, and you reform the pharmaceutical company system of inflated prices, it could work okay in its current form. I think it's the only logical outcome and way to run a healthcare system. There's a reason other countries do this successfully. It would be incredibly difficult to change our system to something based on a universal coverage option from the government due to how entrenched our current system and a significant portion of the economy is into the current setup. Without careful planning, there would likely be a short-term backfiring effect with closed hospital systems clinics, which would reduce access to care. But it's the right thing for us to do. I'm in private practice orthopedics. I'd have much less hassle getting treatments approved. The delay for scheduling elective surgeries might increase a bit. I'd most likely lay off 20 employees out of 70 plus, since I couldn't afford and wouldn't need nearly as many billing office, front desk etc. personnel. I just want the cost of health insurance to go back to pre-2008 recession levels. Example, my first son was born pre-recession. I had insurance through my corporate job. Paid $250 a paycheck for insurance. My wife went to her regular appointments. Paid a $25 copay each time. When the baby came we paid the hospital $300 and that was it. We had a shiny new baby. My second son was born after the recession. I had the same exact corporate job. Same insurance company. But now I paid around $350 a paycheck for health insurance. When it was time for the baby to come we went to the same exact hospital. But now we were charged $11,000. We still got a shiny new baby in the end. But damn the costs changed. As a doctor from a country with free healthcare for all, this thread is completely surreal and makes me incredibly grateful for having it. I can't imagine having to choose treatment or exams based on my patient's finances. I'm a physical therapist. I see everyone saying no more pre-auth required, which is true, but we get a lot more denials from federally funded plans than commercial plans. Medicare has a limit on therapy around 2K, which is about 20 visits. Then you have to write out why someone should be exempt from that cap and you can get another 1K, about 10 visits. Technically you can ask for another exception, but pretty much they don't approve it. I'd say that more than 50% of Medicare patients need that first, and there are quite a few every year that I have to discharge because Medicare won't cover the therapy and the people can't pay out of pocket. The Medicaid plans are worse. They usually have a 2-month limit on therapy, whether they are being seen once a week or 5 times a week. So we frequently have a patient who comes in for an evaluation who then doesn't schedule a follow-up because they need to look at their schedule and then never calls back, or they get a new job, or a kid gets sick, and they miss a couple weeks, and when they come back we only have 4 weeks to address their issue. When the government basically has a monopoly, these issues are going to get worse. Medicare is constantly trying to cut reimbursement to decrease costs. We just spent 18 months fighting to stop a 9% cut and got it down to only 3.6%. How would you respond if your employer told you instead of a raise they were cutting your pay 9%? So people stop taking Medicare because it's not worth it, but because it is illegal to see a Medicare patient for self-pay. Medicare patients have a dwindling number of therapy options. Not a doctor, but stop. I think it's misleading that many people are saying authorizations and approvals for medications and procedures won't be necessary. This is simply not true. Even under free healthcare for all, procedures and meds, at least certain ones, will still need to be approved. Emergency room doctor people would have access to primary care physicians so they could follow up. Unfortunately, initially that probably wouldn't be enough to go around for such a quick shift, so people would probably come to the emergency room for non-emergency issues for a while until that all got sorted out. It would probably also take longer to get people into specialist clinics too for a while until that was fixed. But those are fixable problems with time and would be better than the current situation, where you can't get follow-up for people that need it, or where people avoid coming in until they are too sick. I would love being able to get routine dialysis for my immigrant patients that go from emergency room to emergency room. Primary care physician here. If we get universal health care, can someone besides the current CMS run it, please? This is my biggest concern with the concept. It's clear that something needs to change. People suffering because of lack of access or going into bankruptcy is awful and heartbreaking. But Medicare as it exists now, is such a bloated, inefficient, wasteful mess. Without going into too much detail, I worry that Medicare for All would drive me out of the business, not because of anything to do with my income, but just because of even more of having to put up with Medicare's shit and jump through its hoops. This is just my opinion. You may not agree with it. That's fine. I'm not one who gets into online debates. I probably won't respond to any comments. Having said that about Medicare, though, the private insurance system in America is a toxic cancer that needs to die. I can't decide which is worse. We are in a mess, no doubt. I don't see how this could ever happen. But in my view, the only way we can ever hope to contain costs and broaden access is to somehow go back to health insurance working like car insurance. Something to protect you from financial disaster, not pay for routine maintenance. If most of us paid our own way for routine things, like we do for our oil changes and new tires, the market would control costs much better than the current system of the payer always being someone else. If there was assistance for the poorest for routine stuff, and everyone else paid their own way until there was a catastrophic expense, and there was a universal fund to cover those costs, that's my version of an ideal system. I'd use a plan like that now, if I could. Low cost, high deductible catastrophic insurance. Pay for most things out of pocket. There used to be plans like that, but they were made illegal by the ACA. So now I pay over 1k per month self-employed. So I cover all the costs myself for coverage that is still kinda crappy. The push to make sure everyone has this type of coverage is the biggest part of the mess that got us here, in my opinion. You forgot the serious tag, so this thread will be useless.